We are one of 12 teams that was funded back in 2005 by the Ministry of Health. And our primary role is to go out to long-term care homes in the area of Southeast Toronto to provide consultation around residents in the homes that have significant behavioral issues.
As great as the need is out there, it's a very small team. The psychiatrists do go out twice a week, full-time nurse, and a part-time occupational therapist who basically follow 110, 120 clients.
I always like working with seniors, so I feel very comfortable talking to them. And a lot of them have very rich life experience, so I enjoy listening to their life stories.
In the past, they were painters or musicians or nurses. You knew them better. You communicate with them better.
One thing that the whole team does, that includes Dr. Fisher, Dr. Fornazari, June, and Heather, get to know the person who was there before the illness, working with the individual and their unmet needs. What do these people have? Why are their behaviors such as they are?
Our direct work with the clients or the residents living in long-term care, I feel that they're some of the most vulnerable people around. They're often people who've lost their voice for themselves or ability to advocate for themselves. And some of the people that we work with have had very challenging life histories, survivors of poverty, of various wars.
A lot of very complex medical conditions, plus mental illness, plus behavior issues associated with dementia.
We all have parents, grandparents, the 21st century where the elderly are the majority.
So what we do is we meet with the resident, we often meet with the staff in the homes, try and identify what the problem is, and try and make some recommendations about medications, what we call non-drug related interventions, and then we follow up on these residents to see if our interventions are effective.
Each member of that team will go over and above their daily routine if a crisis emerges. So Dr. Fornazari will make a visit to the long-term care homes on his way into work in the morning if he feels that a patient is in distress. And I know both June and Heather will go into a home at the last minute notice if they hear that a resident isn't doing particularly well.
The other way in which I feel that we're trying to address social responsibility is by offering some support to the long-term care home staff. They work in a very challenging environment in large homes with increasing time pressures, increasing complexities of residents. And the ways in which we can offer the support to them is one small step towards improving the quality of care in the long-term home.
I was very happy when I heard that the Geriatric Mental Health Outreach Program had won the Social Responsibility Award, because I've often thought that they are what we call the unsung heroes. Nobody knows about that program, and I think this is a great way to recognize the hard work that they do and the compassion and the passion that they have for their work. Congratulations.